we're seeing an uptick in patients with IDD in the hospital setting, more so than we ever have.
I think as a nursing profession, we are the front line. We are the ones that are caring for the patients and their families.
The hardest thing is trying to get the medical care that we know they need and keep them safe and make sure that they're not scared.
Ascend is a project that we developed to better the care for our IDD population and people with disabilities. Our goal was to provide nurses with some more education on how to take care of patients with intellectual and developmental disabilities and to give them the confidence to do a good job at it.
Ascend is a package educational opportunity that provides foundational knowledge and understanding of both the experiences of people with disabilities in healthcare settings as well as the providers who engage them in medical services. In Ascend, there are 2 educational opportunities, and people can sign up for Tier 1 or Tier 1 and Tier 2. Tier 1 is designed to engage people in a limited time commitment manner. Tier 1 involves 5 didactic modules that are integrated into the learning management system. Each is 20 minutes, and we also aim to make sure that the modules are engaging. It's a combination of interviews with people so that they can hear personal stories. It includes self-reflection and activities and a little bit of didactic information, all mixed together.
The online modules were important because it provided a great foundation for the hands-on training that we were going to get.
I liked getting the baseline knowledge and education first, and then being able to apply those skills to a real-life scenario.
Tier 2 involves simulation experiences. So in simulation, nurses are doing clinical role plays with standardized patient actors that are organized around disability-specific clinical cases.
There are 3 simulation scenarios that our nurses work through, and they are intended to cover 3 core themes that were identified by our community and nurses as important. The first is advocacy and what advocacy looks like for someone with a disability in a healthcare setting. The second is stigma, and particularly the intersection of racial stigma, disability stigma, and mental health stigma. And then the third is communication. How do nurses and families work together when someone does not use verbal communication in a healthcare situation?
Getting that online education as the pre-learning, but then actually coming in and doing the real-life scenarios does give you that deeper dive.
There's no other trainings that really offer that in-person aspect to really go through the scenarios. Everything else, it's more of you're reading about it or you're just talking about it, but when you actually apply it, it's a little bit different for your learning.
The Ascend package was created in a manner that it could be handed off to another system, utilized within their learning management system with very little effort. It is completely free of charge, and we are there to support any hospital system that's looking to take this in and make it a part of their learning for their nurses or other providers. Hospitals can choose to just do the didactics if they would like, and if a hospital system were interested in adding on simulations, we have many ways that we can do that, including our team traveling there to help implement it, training members of their team, or some combination. We're really looking to work with each system individually to meet their needs and implement this at their hospital.
In nursing school, we didn't have this type of opportunity to learn how to react or play out these scenarios when it comes to a real-life patient. It challenges you to figure out what the best thing you can do for yourself and that patient at that time.
You can have 3 individuals come into an office the same day with the same disability, and they all probably show up in different ways. And just to kind of be ready for that and to understand that and provide a space that makes each of those individuals feel comfortable, even though they present different with that same disability.
It helps them practice those skills that they learned through the modules in a safe environment. Knowing that they can maybe say the wrong thing, do the wrong thing, and it won't cause patient harm. They won't be judged for it, but they'll receive the feedback that they need, that they'll remember, so that way when they're in the moment, in real time, they won't make that same step-up mistake type situation.
The debrief is so important because you don't get that feedback from the parent and patient perspective in a safe environment.
We've been completely astounded by how popular this training has been. We initially aimed to train about 500 nurses in the didactics, and we've already surpassed 2,000 nurses in a really short period of time. Many nurses have talked about how this is the most meaningful training they've ever gone through. It's the most realistic training that they've ever gone through, that they would recommend it highly, that they think everyone at the hospital should take this training. And so I think it's really their unsolicited qualitative feedback that has felt very genuine. Everybody who has participated in Ascend has learned something, whether they've been practicing for 1 year or practicing for 25 years. We truly believe that Ascend will provide important and new information for people at all levels of practice and experience.
This is the best training I've ever been a part of in my nursing career. It is so realistic and so collaborative, and I learned so much from it.
More than anything, I think this training is going to break down barriers, and the barriers that are truly false. The hopes and aspiration of this population is the same hope and aspiration of all of us.
We want to share Ascend with everybody. We are in a wonderful position to be able to offer the Ascend experiences at no cost to other partner hospitals, and we are very much looking for partners in this work.
This program is intended to touch medical providers, health systems, and patients all over the state.
Take the leap. Have faith in us. Do this. Sign your staff up. Give them the dedicated time to complete this training. And I truly believe that it will help you in the long run with your patient satisfaction, nurse satisfaction, all those scores and metrics that we look at. And I think you'll see a great improvement in them.